Staff who triage phone calls at Michigan Medicine play a critical role in serving transgender patients in our health system. Let's look at how personnel can provide excellent service to all individuals regardless of gender over the phone. We'll start by talking about names and pronouns. Jan is working at the call center and receives a request to call a patient and get them scheduled for an appointment in dermatology clinic. Let's take a look at the call.
Hello?
Hi, this is Jan calling from Michigan Medicine for Sarah Smith. Is this an okay time to talk?
Hi, yeah, I can talk now.
Ms. Smith, we received a referral to the dermatology clinic and I was calling to get it scheduled.
Great, my schedule is pretty open, but I'd like to get the soonest appointment possible.
Okay, Ms. Smith, just let me get the schedule open here.
Thanks. Actually, I don't use the name Sarah or female pronouns like Miss anymore. Can you change my name and pronoun in the system?
I apologize for using the wrong name and pronouns, but I would be happy to get that updated for you. What would you like to be called?
My name is Tom.
And what pronouns do you use, Tom?
He, him pronouns. Can you put that in the system?
Yes, absolutely.
Jan did a few things well in that last interaction. She apologized for misgendering Tom. Misgendering, or addressing people using the wrong gendered language, can be avoided by not using gendered terms like Miss, Mr., Sir, etc., and by asking people what they would like to be called. Because your assumptions about someone's gender may be incorrect, greet people kindly without using gender markers. If you make a mistake or misgender someone, apologize. You do not need to dwell on the mistake. A short, sincere apology is typically best. Let's look at another call, this time an incoming call from a new patient.
Hi, this is Jan at the University of Michigan Reproductive Medicine Center. How can I help you?
Hi, my name is Kai, and I'm looking to make an appointment with Dr. Randolph.
Okay, Kai, do you have a referral?
Yes.
Great. Let me look you up in our system. How do I spell your name, Kai?
It's Kai Smith, Kaismith.
Okay. Kai, I'm not seeing you in our system. Have you been seen at Michigan Medicine before?
Yes. I actually used to go by a different name. You can look me up under Alexander Smith.
Yes. I see Alexandra Smith.
Is there a way you can change my name in the system? I don't go by Alexander anymore, and I actually really hate hearing it.
Sure, I'm happy to update your name in our system, Kai. The name Alexandra remains in our system because for now, that's what remains in our insurance information. If your legal name has changed, our clerical staff or registration staff can remove the name Alexandra and replace it as long as you provide the appropriate documentation, like a driver's license or passport. For now, it's important for you to know that in some areas of our health system, staff will only see the name from your insurance records. You may see from time to time the name from your insurance card on some printed items. Please know that we're working hard to change this issue. I'd like to give you your medical record number now so that you won't have to worry about using the name Alexandra.
Thanks.
Also, updating your pronoun in the records will help our staff address you in the right way. What pronouns do you use, Kai?
I use they, them pronouns.
Okay, I'd be happy to put that in the system. These changes will also update how we address you in writing. For example, if we send a letter to your home. Is it okay for us to use that pronoun in all situations?
Yes, please.
Jan did a few things well in helping Kai during the last scenario. Jan offered to give Kai their medical record number so that Kai can identify themselves using their medical record number in the future, instead of having to use the name on their insurance card. Jan also did a good job of updating Kai's name and pronouns in the system. It is also important that Jan confirmed that it is okay that future correspondences to Kai's home will use this name and these pronouns. If, for example, Kai is not out as transgender at home, they may not be comfortable with this change. Finally, Jan alerted Kai that there are areas of the health system where Kai may see their name from their insurance card listed. In order to find Kai in the system, Jan should have given Kai an option to give their medical record number initially. Let's try that part again.
Hi, this is Jan at the University of Michigan Reproductive Medicine Center. How can I help you?
Hi, my name is Kai, and I'm calling to make an appointment with Dr. Randolph.
Okay, Kai, do you have a referral?
Yes.
Great. Let me look you up in the system. Can you either spell your name or provide me with your medical record number?
Yes. Let me go get my medical record number for you. One sec.
Finally, to make Michigan medicine a safe space for people of all genders, it is important that we address discriminatory behaviors. If you witness inappropriate or derogatory behaviors, such as a colleague mocking a patient's gender identity, this should be reported to your supervisor. This behavior is grounds for disciplinary action. If you do not feel comfortable talking to your supervisor, please contact the Patient Civil Rights Coordinator. To recap, personnel staffing the phones at Michigan Medicine play a key role in serving transgender patients and visitors to our health system, in order to ensure we provide excellent care to all people regardless of gender. Avoid assumptions about gendered language. Apologize if you accidentally misgender someone. Call people by the names they request to be called. Reflect this in your charting and update demographic information in MyChart as needed. Recognize the difference between sex assigned at birth and gender identity and document accordingly in MyChart. And speak up if you hear a colleague acting or speaking in a discriminatory or derogatory way. For those interested in learning more about gender-affirming care, resources including the World Professional Association for Transgender Health and the publicly available guidelines for the primary and gender-affirming care of transgender and gender non-binary people on the UCSF Center of Excellence for Transgender Health homepage may be of use.